friends, it's time for our Ask the Doctor segment with Dr. Hanna Merchant, who is answering a viewer question. Hi, Dr. Hanna. Thank you so much for being here.
Thank you, Val, for having me.
We had a viewer submit a question to our website. Deborah asked, why does she have urinary incontinence when she's never had children?
Oh, that's a great question. You know, this is something that we don't always talk about because a lot of people feel shame or feel isolated from having this issue. You know, people oftentimes don't want to go to certain places because of fear of not having a bathroom nearby. So I'm glad we're talking about this today.
Yeah, me too.
First of all, you can have urinary incontinence without having a child. In fact, men can have urinary incontinence as well.
Oh.
Yeah, so there are many reasons that people have urinary incontinence. One is an overactive bladder, which is basically you're not getting to the bathroom in time, and there can be some nerve issues there. There's also a weakened pelvic muscles that can cause urinary incontinence, and specifically childbirth is one of the common ones, but also age and menopause play a factor, and then also when you have chronic coughing, so for instance in asthma or smoking, that can also contribute. High impact sports can weaken your pelvic muscles. So for instance, running or jumping for long periods of time, especially in your youth, can contribute to that as well.
So would you say that you don't start seeing urinary incontinence until later in your life? Or?
Yes,
Okay.
yes, that's very possible because these factors add up over time.
I see.
Also, obesity or straining from constipation can contribute to urinary incontinence, and then genetic factors can as well. Then you also have to look at, are you on any medications that can contribute? Like for instance, some blood pressure medications, diuretics, muscle relaxants, those all can contribute as well. Then there are anatomical issues like a tilted uterus or congenital abnormalities.
Wow, that's a lot of different reasons. So what can we do about it?
Well, first of all, don't just live with it and don't feel isolated by it. Talk to your doctor, who may refer you to a urologist or a urogynecologist to evaluate the possible reasons why you're having this issue. And then one big thing that we recommend is Kegels exercises. And you know what's great about Kegels exercises is that no one knows that you're doing them. You could be standing in line at the grocery store. I mean, you and I could be doing them right now and your viewers wouldn't even know. Also, there are physical therapists that work on pelvic floor strengthening.
Great suggestions. I'm glad that there's so much that we can do about it, especially the Kegel exercises. That is something easy that can be done at any time of day, anywhere.
Anywhere.
Yeah, I love
exactly.
that one.
There are medications that treat overactive bladder, and then see if any of the medications you're currently taking can be changed so that you have less of a risk. Maybe keeping a diary of your fluids and how much caffeine, and seeing if that's related to when you're having these problems with incontinence. Bladder training is another method to use, and then if nothing else, and especially in the meantime, you can use incontinence pads or urinary pads while you're trying all of these other methods.
Now, is bladder training similar to the Kegel exercises?
No, they're much more specific than the Kegels exercises.
Gotcha.
If you're having tea, if you're having coffee, and then you're getting up to go to the bathroom and you're running to the bathroom in the middle of the night, well then limit when you're taking in any kind of fluids by about 7 p.m. and then you're less likely to need to go through the night. Men can have these issues as well, but one thing that men have that women don't is a prostate, and that can really contribute to their risk of developing urinary incontinence. Talk to your doctor about it. Get that referral. Go to see a physical therapist regarding pelvic floor exercises, and find treatments that work for you. There's no reason to limit your life, limit your ability to travel or go to parks in fear of not having adequate bathroom facilities.
Right, and it sounds like there's so much things that can be done to improve that, right?
Absolutely.
Thank you so much, Dr. Hanna. Always such great information. And thank you, Deborah, for submitting that question. And I'm so glad that you weren't afraid to. For more pro tips, head to our website, fashionsensehawaii.com, where you can also submit your question for Dr. Hanna. We'll be right back.
Presented by D. Suihiro Electric Inc. on Spectrum OC16.